Heroes Cable Network.
Our culture, traditions, and education is gradually diminishing in our community. Here at HCN, we are determined to explore, to learn, and to promote indigenous African culture, which is the value of we, the African people. Traditions, the consciousness of our heritage in our food, music, marriage, our beautiful languages, and most importantly, our religion. Join me here on Heroes Cable Network as we take an educational journey to explore, a journey to unveil the untold stories of Africa. HCN, our goal is to elevate and celebrate our culture, traditions, education, and development in our community. My name is Sakosia. Explore African culture and traditions with us here on Heroes Cable Network. HCN, we are one.
Hello, you're watching Heroes Cable Network, and my name is Ms. Dill. This is Women's Digest. So today we are here to create, the awareness on breast cancer. We all know October is a month that has been set aside to create awareness on breast cancer. Now, there's research has said that men also get breast cancer. And I learned about 3% of people who are infected by breast cancer are men. But I think that 3% is just those who are reporting it. So what about those who are not reporting it? Those who are shying away from people knowing that they are also going through all that. And so there are a lot more men out there who are also being infected by breast cancer. And so today we are here to create the awareness that not only women have that, not only women go through breast cancer, not only women have it, but men also go through that. They also get it. There's a possibility that a man can also get it. Research also tells us that there's a number of female, and we all have a number of female and male hormones in us. So if your female hormone as a man is more, and you see, that's why we see some men who have breasts and all kind of stuff, features of females on them. And so if you see that as a man, you should be doing your breast examination and going for routine checkups, so you don't fall into that category. And so today I'm here. I have my professional guests with me on here, and we also have 2 survivors who are going to tell us their story. You are watching HCN Heroes Cable Network. Be sure to like us on Facebook and on YouTube. Just hit that notification button, so anytime we are online, you'll be the first to watch our programs. Heroes Cable Network, we are all about promoting culture, tradition, education, and development in our community. Again, my name is Ms. Dell, and this is the Women's Digest. Stay tuned and don't go anywhere.
Heroes Cable Network.
Welcome back. You are still watching HCN Heroes Cable Network, and as you know, we always want to promote our culture, our tradition, education, and development in our community. This is the Women's Digest. I'm going to introduce my guest here with me. On my immediate right is Mrs. Abba Amprofi Ham. She's an RN and she has BSN as a nurse, and she's also the president of the Ghanaian Nurses Association right here in the Dallas-Fort Worth Metroplex. Next to her is Margaret Corte Papafio. She's also an RN and a BSN, and she works right here as a nurse in the Dallas-Fort Worth Metroplex. So going to join us via Zoom will be Mr. Abeku Arthur. He's a survivor, and he's a retiree from SNIT. SNIT, if you don't know, SNIT is like the Social Security Office in Ghana. So he's a retiree, and he is a breast cancer survivor. We also have Miss Amber Bertie. She's also a nurse, an RN BSN, and works at the Neonatal Intensive Care clinical educator at the Methodist Hospital, Stone Oak in San Antonio. Welcome, our guests. Welcome you all.
Thank you for having us.
All right, thank you. So now I'm gonna go to my guest in the studio, and we want to know about the prevalence rate and the causes of breast cancer.
Thank you for having us, Ms. Dell. So, breast cancer, when we talk about the causes, what happens is the cancer in the cells, it overgrows abnormally. So when that happens, it invades the good cells in the body system. Or maybe we can say it eats all the good cells in the body system. And when the bad cells, which is the cancer cells, abnormally overgrows, it accumulates in the tissues. So when it accumulates in the tissues, then it forms a lump or a mass in the body. So when you talk about the prevalence rate among men and women, both men and women get breast cancer. What happens is that survival rate is basically the same. I think according to CDC, it says that one out of every 100 men will be diagnosed with breast cancer, and 1 out of every 8 women will be diagnosed with breast cancer. Once again, the survival rate is very the same, but the only problem is men, since they don't do the self-examination, it's hard for them to get early detection. So therefore, when they find the lump or mass in their breast, the chances of getting cured is very, very slim. There are so many causes, if we think about how breast cancer happens, you're looking at perhaps the age, especially just being a woman, that your risk of getting breast cancer is very high. And also growing old age, and when you're a woman that had your early menstruation before the age of 12, you're at risk also. Environmental also can happen. Maybe chemicals like pesticides also can cause breast cancer. Again, like I said, men and women, and even white men and white women and black women also have the same risk for having breast cancer. But the problem is black women, actually, the death rate among them is very high. Again, I think it's also, we're looking at not doing the self-examination, so the chances of surviving is very, very slim. Now, do you want to add anything?
I think you covered it all. It's 1% out of men that population gets. So I know you said 3%, but
yeah,
usually
that's what I read.
Yeah, but also not that you're wrong, but American Cancer Association have a different number. Women, College of Women Gynecologists also have a different number.
Okay.
So everybody is different.
Yeah, and then the World Health Organization also has,
yes. So it varies in everything. But I think Abba covered it all. Yes.
So at what point, let's say during the month, is there a particular time a woman or a man has to do this self breast examination?
Yes. Usually for women, before you start your menses, your breasts become tender and engulged, or not like breastfeeding, but you still get some tenderness and engulgement in your breast. So it's actually recommended that you do your self-breast exam a week, 3 days to a week after your menses to do your the self-breast exam. And because men do not have menses, and menopause women too, they can just select a time of the month. It can be any time, beginning of the month or end of the month or whatever, to set it as a time for their self-breast exam. Because the women, they said after your menses, because at the time during your menses is tender, and you don't want to add any more pain to the breast.
Okay, so like a man asked me this question when they saw a post. I'm like, men get it too. And we was like, okay, we don't have, what if your man in your chest is so flat? How are you going to do it?
That's a good question to ask, because men also have breast tissues, you know.
Okay.
I think somebody also asked me the same question, that
Me too.
how do you know men get breast cancer? And I said, they do. They have breast tissues as well as women. I think the only difference is they don't produce milk. We have the breast, you know, women breast is more, especially if you have a very dense breast tissue, like the fibrous tissue that is going to hold your breast together. And then the glandular tissue is where you produce milk in, you know, and men don't have that. So again, the chances of a man getting is very slim, you know, even though it's not, I wouldn't say slim. Men and women both get it. But yes, we all have breast tissues. So you will find a lump or a mass in your breast tissue.
Okay. Yeah. But I think so the men who have a lot of the female features, if you're a man and then you see that you have breast, you know, that is so obvious, or any other female features in you, I think it's also a sign for you to be doing a regular, you know,
breast check. Absolutely, yes. Yes,
yeah, right.
It is.
Thank you so much, Ms. Abba and Margaret. We'll go for a commercial break and we'll be right back. Stay tuned.
Our culture, traditions, and education is gradually diminishing in our community. Here at HCN, we are determined to explore, to learn, and to promote indigenous African culture, which is the value of we, the African people. Traditions, the consciousness of our heritage in our food, music, marriage, our beautiful languages, and most importantly, our religion. Join me here on Heroes Cable Network as we take an educational journey to explore, a journey to unveil the untold stories of Africa. HCN, our goal is to elevate and celebrate our culture, traditions, education, and development in our community. My name is Sakosia. Explore African culture and traditions with us here on Heroes Cable Network. HCN, we are one.
Welcome back. You are still watching HCN Heroes Cable Network. And as you all know, we always want to promote our culture, our tradition, education, and development in our community. Today, we are all about creating the awareness of breast cancer. Breast cancer, yes, we all know. You might know one or two people who have gone through this. And I know if you're closer to a person or it's a family member or somebody who is close to you, and you get to see how, you know, with all this, all that they go through, you know, the chemo and all that is very difficult. And so we all don't want to get in there. We want to create the awareness. We don't want you to get to that stage before we start creating the awareness. No, we can start right from today, and that is what we're doing. And so we're going to go straight to our guests via Zoom, who are joining us, Uncle Abeku from Ghana and Miss Betty from San Antonio. Hello, Uncle Abeku.
Hello.
Hello, you're welcome to HCN.
Thank you. Greetings from Ghana.
All right, then. Okay, so Uncle Abeku, we want you to tell us your story, because I know everybody will be wondering, how did you even detect it? How did you get to know you had breast cancer? We want to know all the processes that you went through. But before then, do you have a scar?
Yes, I do. Yeah.
Yeah, would you be willing to show us the scar? Sure.
Yeah. Okay, hold on. Can you see it?
Oh my, yes, we can see it. So you had it on both breasts.
Right.
Wow.
No, one, but they decided to do the two. Yeah.
Oh, okay. So how did it all happen?
I used to have, like you're saying, I used to have big breasts. More, the normal male breast was bigger than the normal male breast. Mm-hmm. And until I was told I had cancer, I never knew men could get cancer too. Anytime I wore t-shirt to office, the ladies were just fondling with my breast, and I felt so embarrassed. So I decided that I was going to ask my surgeon what can be done about it. Mm-hmm. So he told me, like you have people are saying that he thinks the hormones, the female hormones, are more than what I have. Mm-hmm. So my breast can be reduced nicely, the tissues can be taken off, and it could be reduced nicely for me. So I accepted that I would want to do that. But whilst I was working, I was on a very heavy schedule. So I kept on postponing it. But once in a while, I would see a dot of blood on my bed. Mm-hmm. And I said, this mosquito bite. But later on, I realized that all my netting were intact and everything. So one morning, whilst I was ready to go to work, I put on my singlet, and I saw a dot of blood at the left side of my breast. Mm-hmm. So I squeezed it, blood came. But even though I didn't take it because I didn't know my breast cancer. Yeah. So I went to work. I normally go to work early. I do my quiet time with my God before we start work. That day after my quiet time, there was this still voice telling me, go and cut your breast, go and cut your breast, go and cut your breast. So the whole day I couldn't work. So I called my surgeon, look, I'm ready now. Do it for me. So I went, the surgery was done nicely, the tissues were taken out, and I became manly with my nipples all on. Mm-hmm. Then after 3 weeks, he called me. He said, look, come. And when I went, he said, look, your left side is cancerous.
Wow.
I said, wow. Yes. So that is how come I detected that men can get cancer. So I had to go back for a proper surgery to be done, to get to the name. You know what I'm talking about. So I had to go for the second round of the surgery, mm-hmm. where they scraped everything off. Then I went for chemo, and that's the horrible side of it all. Mm. Yes, like you are saying, it's poisonous, which is injected into you, mm-hmm. and it kills both the good and the bad cells. Wow. So you become uneasy, you feel very uncomfortable. Mine was that after 3 days, all my taste buds were dead. I couldn't even eat. But you have to get that momentum to get blood to go for the next shot, because it has to be continuous. Mm-hmm. So all that I would do, I would just put in the food in my mouth, and I was swallowing with coconut water just to keep me surviving. Mm-hmm. So after 3 weeks, I had to go back for another shot, and I had to get 6 shots. Then I did the radiation. And by the grace of God, if I don't show you my chest, here I am sitting down. It happened in 2007, so 13 years down the line. If I don't show you my chest, you might think there's nothing there. Yeah. So that's the gist of my history.
Wow. So after all this, do you still go for like a yearly routine checkup, or is there anything you have to keep doing?
No, I stopped. No, I went for a while and there was something, so I stopped. So I'm now living my normal human life. I've willed myself to God because I know He healed me.
Yeah.
Yes.
Wow, wow. Thank you for telling us your story. Wow, wow. That's why we are here. We don't want anybody to go through all this, because you can hear if
It's terrible.
poison has to be,
That's terrible. Yeah.
injected into you
Yeah.
to get all this cancer
Yeah.
out. It's horrible. It is a horrible situation.
Very, very.
And
Yes, yes,
yeah,
yes, very.
and we're glad you went through all that and you're still right here, alive and kicking, and
Yes.
trying
By
to create
grace.
the
Yes.
awareness out there. Thank you so much.
Yeah.
We'll go straight to Miss
Welcome.
Amber, our second survivor. Hello, Miss Amber.
Hello.
Hey, how are you doing?
Good. How are you guys?
Good. Thank you for being on the show.
Thank you guys for having me.
Good. So we want to hear your story as well. How did it all start?
Okay, awesome. So my story is a little different. I was 29 years old when I found out I had breast cancer. I was breastfeeding my son at about 12 months of age with my son. We started having some difficulties with the breastfeeding. It was very painful. I sought out some advice from my OBGYN, went in. At this point, I did have a nodule that had developed underneath the nipple line of my breast. We went ahead and did an ultrasound at that point. It was presenting itself like mastitis, which is an infection in the breast due to breastfeeding. So it was treated as such. We went ahead and continued to monitor it on for a couple of months. My breastfeeding and everything started to get a little bit better. He was doing fine on that breast. It wasn't painful anymore. And then I was being checked by the doctor and getting ultrasounds monthly at that point to make sure that the nodule was changing in size. And at about 18 months of life, I started having some difficulties again. My son started to deny that left breast and did not want to breastfeed anymore on it. And so I started having a lot of changes within my breast. The breast tissue started to change. I could feel the nodule again. It was just very painful. It started to bleed. And like I said, my son started to deny that side. He still wanted to breastfeed on the right side, but only that side. So I called my doctor. I actually had an appointment within 2 weeks of that time frame. But I went ahead and called them and let them know the situation ahead of time, what was going on. And they had me come in and we did a ultrasound with a biopsy at that point. And that's when they determined that that nodule was cancerous. So it was stage 3 cancer, which meant that it had progressed into my lymph nodes at that point. And so at that point, we started the treatment program. Within a week, I had a chemo port placed in, and I started chemo. I did chemo every 3 weeks for up to a year. I also had 6.5 weeks of radiation, and I did have a full left breast mastectomy at that point. So it was a very fast treatment, and my son was the one who figured it out first.
Wow, that might have been a difficult situation, considering the fact that you had a baby, so you're going through all that with a baby, and then you have to take care of yourself as well. I don't know. I can't imagine how how you did it, but yeah.
Definitely tough.
Wow.
But your children are what keep you going, definitely. So. Yeah.
Wow. So how did you find strength for all this? And did you have a support group?
So I did. I have a really great family. My dad was very supportive. My sisters are great. I have a really great best friend. And my focus was my son. You know, every day I looked down at my son and I said, you know, he needs a mom in this world, so I have to fight for him. So that was what my reasoning for going on. I didn't allow cancer to stop me from living life. I still worked full time. I had a really great work support system. They would help me with making sure that I could work the first half of the week and had days off afterwards, after my chemo sessions to recover back, and great friends who would bring meals over, come over and just talk. And my best friend was super amazing. She helped watch my son through all my chemo treatments. And yeah, so I really did have a great support system, and that really did help me continue going on with everything. So.
Wow, I'm glad you put through and you had that strength. Like, you know, I need to do this for myself and for my son, and I'm glad you did it. I'm glad you did it, and thank you so much. Is there any other thing you want us to know? Is there anything you're doing, like on social media or out there, that you want people to know and give you all that support?
You know, I've recently, you know, been very open about this. I do, my name's Amber Beatty. I'm on Facebook. So if anybody ever has questions or anything, I'm, like I said, I'm a nurse, but I don't give medical advice on there. I just am here as a support system to other women who just need that extra person to talk to. And, you know, if you're just need that person that's been through it and totally understands it, I'm totally there and open to having people talk to me on there as well. So
well, yeah. Thank you so much. We appreciate you coming on to share your story with us. I know you have to go, so thank you so much. We appreciate you, and you know, let's keep creating the awareness.
Yes,
keep doing
definitely.
what you're doing. God bless you. Thank you, Miss Amber.
Thank you.
So we move on to Uncle Abeku. So how did your family take the news?
Yes, I want to add something to what Miss Amber said.
Okay.
If you are going through treatment, you don't have to get people cheerful around you. Otherwise, you buckle up.
Okay.
You have to get strong-hearted people around you who will cheer you on. I was fortunate. My wife is a strong-hearted lady. So when I was going through pain and shouting, and even men around me were all crying, she stood positively. So I looked at her, and with God, I survived. So please, if you are with somebody going through treatment, never buckle up in presence of that person, or the person will just get dejected. So I think what Ms. Amber said is true. You have to get cheerful people around you, and that's what sustained me to go ahead. Yes, so my wife was really supportive, and prayers all over. I wasn't feeling shy to tell people that, look, I have cancer. I know if 100 people listen to me, about 80 people can pray for me. 20 may be negative, but 80 people can pray for me. So I was just spreading it that, look, I have this, and I know with medicine and God, I will be healed. And that is what I did. Because
I know a lot of people out there back home feel so shy. They don't even go to the hospital to get checked. I know of a lady who died out of that because she, you know, the breast got rotten.
Learned people.
And it's so sad.
Learned people do.
It is sad.
That is why we are creating this awareness. Yes. It's so sad. I don't know why they think it's a stigma, but I didn't feel that way. I didn't feel that way. I thought maybe God gave this sickness to me just to create awareness. So sometimes people ask me, why you? And I ask them, why not me? Why should God give to somebody else? Why not me? Because God knows I can survive and help people. That is what we are doing here now. And aside that, you know, I have support from my church. You know, when I was doing my treatment, people were dying because of stuff like $50, $100. They were dying. They were not having the money. So I told God, if He should heal me, I will solicit funds to go and pay for those who can't afford. And
Uncle Abeku, so do you think the financial, restraint is also, is it something that pushes people, back?
Look, early detection, not hiding it, having money. and by the grace of God, you can survive.
Okay.
You can survive.
I know.
But it's a
that
very
chemo costs a
expensive,
lot
you
of
know,
money.
what treating. Exactly. So, but I was fortunate because I was working with SNAIDS. All my medical bills were taken care of. They were, you know, very expensive. The better the drug, the more expensive it is. But they paid everything for me. But people were dying just because $100, so much $150. They died because they were not having the money to come back for treatment.
Yeah.
So this is what we have been doing. My church is very supportive. You know, I worship with Emmanuel Methodist Church at Accra, Emmanuel Estates.
Okay.
So I told them the plight of these people, and they were convinced and they give money. Just last 3 months, we almost spent almost about 61,000 Ghana cedis. That's, I don't know how much converted that to. And we go to the children's ward. So when you go there, you feel so sad. 4 years kidney cancer, 6 years eye cancer, 9 years throat cancer, and they are all from poor family.
Yeah.
So this is what we have been doing. So let's create awareness so that people will be alert. Men, please don't feel shy. Go for checkup. I was fortunate that the boys spoke to me and they detected early, so it didn't spread. I'm here. So please continue creating the awareness for the men to know that we also get some.
Yeah. Yeah. So as Uncle Abeko is saying, early detection is key.
Yeah.
Early detection is
Very key. That's the key.
And that is why we want everybody to be doing the check. Go, do your self check.
Yes.
The self breast examination, and that's what. Okay, so we are going to watch that video. We're going to watch a video which is going to show us how to do a self check. Okay, how to do it by yourself. Let's watch that video now.
Discharge. Some discharges can be normal due to hormonal or medication. However, all discharge should be reported to your doctor. Note: the color of the discharge, whether it comes from both breasts and whether it comes from one or more openings. To make easy, use oil and either apply some oil or soapy water to allow easy palpation. Next, press your hands firmly on your hip and lean slightly towards your mirror as you pull your shoulder and elbow forward with a squeezing or hugging motion. Look for any change in the normal shape of your breast. Now, bend forward at the waist. Hold your head up and look in the mirror. You may notice that one breast is larger than the other, and this is normal. Looking in the mirror, raise your arms and rest your hands behind your head. This allows you to see the underside of your breast. Roll your shoulder forward and reach into your underarm area and check for enlarged lymph nodes, such as small glands that's filled with fluid when you have an infection. An enlarged node will feel like a corn kernel or a bean. Also check the area above and below the collarbone. Repeat on the right side. Raise your left arm. Use the pad or 3 or 4 fingers of your right hand to examine your left breast. Use 3 levels of pressure: light, medium, and firm. While moving in a circular motion, check your breast area using a set pattern. You can choose. Be sure to cover the entire breast and check behind the nipples. Wedges. Starting at the outer edge of the breast, move your fingers towards the nipple and back to the edge. Check your entire breast, covering one wedge-shaped area at a time. You should not lift your fingers while feeling the breast to make sure no area is missed. Whatever method you choose, make sure to cover the entire area.
Welcome back. So we've all watched the video on how to do a self-check. Okay, you can always go back to YouTube, and then watch the video. If you're ready to do it, just go back, click on Heroes Cable Network, and just go through the process. And for women, it's 3 days to a week after your menstrual cycle. But for men, I think it's any time during the month, right? Yeah, so, and I'm going back to my guest in the studio. Is there any special, I noticed there was a lot of oil on the lady's breast. Is there any special oil we need to apply to it before the self-check?
Not really. It's only for the smoothness of your hands running through the breast so that you can feel any nodule that is in there. But it's advisable, like we heard in the video, it's advisable to do it in the shower, because after you put all that oil, then obviously you're going to take a shower.
Yeah.
So if you forget to do it in the shower, or you don't want to put oil in you, not to limit anybody from doing that, you can still do it like without the oil and stuff. It's just for easiness to feel it easy. And like the video showed, that you can go in a circular motion, or you can just stroke down to the nipple side. And I don't know whether it was mentioned in the video, you always also want to press on the nipple to see if there's any discharge. So whilst you're feeling your breast, what you're trying to notice is not just the nodules, but also any changes in terms of texture or thickness of the breast, anything that has changed in your breast. So in the video, I know she mentioned you put your hands on your waist and do this. Doing this will pull everything in, so you can see the muscle and see if there's any dimpling. Dimpling means there's something wrong. So that's the texture. It means like you know, like it's in and out, like a dimple. And all those things are signs of.
So do you have to do it standing or sitting? Since you have to, scoot a little.
You can do it either way.
You can sit so long as the breast is hanging.
Yes.
Or even if you're laying down
in bed and you put your hands.
You put your hands on the back of your head and you do it.
it.
But when you're laying down, you cannot see. So whenever you go to the bathroom, it's not gonna hurt to just do this and then lean forward a little bit for the breast to hang for you to see.
So on the funny side, I've heard people say, "Oh, if you're married, you need to let your husband do that for you, or your boyfriend or something." How true is that?
I mean, there's no harm in doing that, because they will become more used to your breast also. So they'll be able to find any lump or mass in it, or as well as yourself. So if they do it, I mean, it's a plus, Perhaps they'll be able to find it sooner than you have, because they play with it all the time. So I don't think there's a problem with your husband or your boyfriend playing with your breast. Yeah.
It helped, like Abba said, it helped catches if there's any form of change, because they usually gets to feel it more than,
yes.
So if there's any change, I think I feel this, or
something different.
That's why they say that. But then, I mean, it's not gonna hurt anything. If, they notice anything.
So apart from the self-check, what else do we need to do? Is there any other routine checkup, anything that we need to be doing as women or men?
Yes, there are so many things you can do. Lifestyle modification. If you drink alcohol, especially women, it's recommended to have a drink a day. I mean, if at all you want to drink, if you don't want to drink at all, that's even a plus. And exercising. If you exercise, you eat healthy diet, you maintain healthy weight as well. Like I said earlier, being a woman alone, you're at risk of having breast cancer. So when we exercise, environmental factors also, it's part of it. Pesticides and chemicals those are the things that can cause breast cancer. So if you do your exercise, if you eat well, you limit your alcohol intake. These are the things that could prevent you, or it will reduce your risk of having breast cancer.
All right. So it still comes back to early detection. We're going to take a commercial break. Don't go anywhere. Stay tuned. Obey your hunger. Come to Benji's Catering Services, the best shitter and kinky factory. We supply most African markets in the DFW and Houston Metroplex. We also ship to anywhere you are. Benji's Catering Services is your special location destination. We provide cuisine for all your events, weddings, birthday parties, naming ceremonies, conferences, and what have you. Be it shitter, kinky, fish, jollof, wache, fried rice, Local and continental.
So, our number is 832-670-7653. 832-670-7653. Benji Catering Service. Your satisfaction is our guarantee, or your money back.
Welcome back. This is the Women's Digest, and today we are digesting on the awareness of breast cancer. Yeah, breast cancer. And now we know it affects both men and women, and so we are all at risk. We all have to do our self-check, our monthly self-check, so, in order to have an early detection if there's anything there, to take the necessary steps to prevent, it getting worse. We're here in our studios with Miss Margaret and Miss Abba, who are helping us. And then via Zoom, we had Uncle Abeku and Miss Amber. So, mammogram.
So mammogram, mammography, they said it remains the gold standard technique in screening. So that also detect early cancerous, if you have the cells. There is when you look at so many health organizations, they are all talking about different ages where you can have mammogram. Some are saying at the age of 40, others are saying from 40 to 59. Others are also talking about the age of 55 till the age of 74, So the best thing to do is to talk to your primary physician or your gynecologist. They will determine when to do your mammogram. When you go and do mammogram, it's like you're doing a panini bread. Your breast is basically the meat. There's a bread and the top, and it presses. The good thing is, in the past, it used to be metal. Now it's changed to plastic, so it's not that painful. It is painful. I have done it before. You have to hold your breath. You don't breathe. You feel like you're going to pass out. That's when they take the pictures. So when they take the pictures and they find anything like a dense or different tissue, they have to take a sample, which is called a biopsy, and they take it to the lab to test for any cancers. So once again, mammography remains the gold standard, technique in screening. And this is also based on when you have done your self-examination at home and you find something that, okay, it's different than what you usually feel. Then you talk to your gynecologist or your PCP to send you to a specialist to do the mammogram. Once again, the age differs. They said age 40, you can do it yearly. If you're in good health, which means they're going to tell you to do it maybe bi-yearly, twice, every other year that you have to do. So, do you have any?
And I know this all comes down to money, but from Amber's talking, I don't think she said it on this one, but from her experience, absolutely you can go through all this and not pay a penny. And also even here, even if you don't have insurance, you can still get mammogram and stuff like that, and the government will pay for it. It's a health awareness, and it's a preventative care. So most insurance will probably pay almost everything, or maybe pay late, like you pay later to that.
Yeah, because I know there are some institutions that there's one in Fort Worth. I forgot the name, but they do, you just apply and then you can go get yourself your breast checked, or your mammogram done yearly for you at no cost. So we all have to look out for all these organizations and institutions in our society that help us do all these checks for free at no cost. But then our folks back home, that is the problem. Our folks back home don't have those privileges as we have here. And so I think that's why Uncle Abeku and his team, and there are some other organizations and people out there who are creating the awareness and helping put funds together to support all those who are going through all this, breast cancer, whatever. I don't even know what to say. So if you're out there and you're going through this, do not feel shy. There's nothing to feel shy about this. You didn't put it on yourself. You didn't ask breast cancer or any other disease to come upon you. It came. And so you have to seek help, seek for help. Go out there. You need to tell people. That is, there's a saying in our can. It says, "Uton wo yari na exactly." So when you say your sickness or whatever it is that is worrying you, that's where people will get to know and give you the necessary help that you need. So please, 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 especially our folks back home in Africa, in Ghana, Nigeria, wherever you are, please do not hide it. There's nothing to feel shy about this. Do not hide it. Rather help to create the awareness to help people not to get to, whatever state or whatever it is that you're going through. Let's help each other. And so, Uncle Abeku, your last words to our viewers out there.
Well, said it all. Early detection is very key to solving the problem. So go when you check. You don't go to pastors, fake pastors, who are going to tell you, "Oh, I've healed you." No. Add medical science and prayers, and God will save you.
Exactly.
So, men, please don't wait till October. Every month you can go and check. And please, those of you who are the cable network, don't wait till October before you tell the men to go. Once in a month, just broadcast to them, "Hey, go and check," to save a lot of souls.
Sure will.
May the good Lord give you people the strength to continue educating people so that they don't fall into the trap. That is very horrible going.
Well, thank you so much, Uncle Abeku. We do appreciate your time and everything that you put into joining us here from the Dallas-Fort Worth Metroplex to educate our folks out there. And we thank you so much for all that you're doing as well to create the awareness with your team, your church, all those who are supporting you financially and in any other aspect. We want to say thank you all for what you're doing, because we all need to do this to help our society. We need to do it to help each other, to bring each other up. So thank you for all that you're doing. And as you said, as you've asked us to do, we'll continue creating the awareness. We'll keep, broadcasting it. We keep asking our folks to go get their yearly check, go get your mammogram, and in addition to doing your self-check, because early detection is very, very important. Very, very important. That is what is going to help you not to get any worse than, you'll be. So thank you, Uncle Abeku. Thank you so much for joining us.
Welcome.
Miss Margaret and Miss Abba. What is your advice to our folks out there?
I mean, just like Uncle Abeku had already said, and Amber also said, we just have to keep doing the examination. If you keep doing the self-examination, you're going to definitely, and as a matter of fact, if you become familiarized with your breast, if you get to know your breast, you'll be able to see the difference. Margie talked about dimpling. Our survivors talked about discharges. You're also going to feel some pain or flaky skin around your nipples. So those are the things you have to look for. If you do it continuously every month, you're going to, if there's any difference, you'll be able to tell. You don't have to wait to get that far before. So keep doing that. And then again, the lifestyle modification. Let's change our diet. Let's exercise more. If we drink, let's limit the drink that we take in a day. So those are the things that we can do. And even the women that are taking hormonal therapy, you might want, and then if you're taking any contraceptives, you would want to talk to your physician and ask for the benefit or the risk before you take those. So those are the things I think we will tell you. We just want to let you know this is education purposes. We are not here to give you any medical advice. But please do your breast examination every day. I mean, not every day, every month. Like Margie said, 3 days to a week after your menses, you should be able to do it. And the men also, or if you're in your menopause, you can choose a day. I mean, if you're born maybe in August, you can choose the day, the 8th of every month to do it. If you're born in December, you can choose the 12th of every month and do it so that you will remember that. Okay.
Wow, that's a good key.
Yes.
Thank you.
Also, added about we didn't mention about genetics. Sometimes, if you have a sister, aunt, mom,
grandmother,
that have had it, and sometimes you might not. But if you do have those, it's advisable for you to get those checks early. Talk to your doctor, and then they will make you do the mammogram earlier than the age of 40 and also test genetic testing, which is there are different genetic testing, which is BRCA1 and 2 or HERS and stuff like that. So they will tell you what kind of cancer or anything that you have. Also, Abba was showing me on the phone, somebody had a question that they texted about deodorant. I just had my mammogram, and they usually, before you go, it doesn't put you at risk for getting breast cancer. It just made, whenever you do the mammogram, it shows particles like some white patches, and they can mistake that as a cancer.
Okay.
And so that's before you go, they'll tell you to not
to put it on. Okay.
Or any powder. So that yes. So deodorant does not cause any breast cancer. It's just to make sure that they don't assume seeing that white particles under your armpit also, as because you have lymph nodes under your armpit. That's where you have a lot of lymph nodes where it filters all your cells. So they don't want to assume that you have it. And then that's another reason why when you do it, you do the examination from your armpit. Because of your lymph nodes, you could feel some lumps over there and around your nipples too. So deodorant does not cause, at least from the research we did, we didn't see that deodorant causes breast cancer.
And then from what Margaret just said, it brings my mind to the fact that when you go to the clinic, when you're going to take your, when they give you the form to fill, they're like, there's a section for family history. So I get it now. So please do not lie on that.
Yes.
For your own
yeah, unless if you don't know, then you don't know. But if you know anybody in your family close to you who has had it, please put it on there so they know what to do, the necessary steps to take. So it's very, very, very important. Very, very important.
Especially to the men, to the men, to the men, to the men. Our men, our husbands, our brothers, our uncles, our sons, they should take this very serious. Make sure that they examine their breast. Most of them are thinking they don't have tissues. Everybody, as long as you're a human being, you have a tissue and you have cells. So take that opportunity and do it. If you can't do it, let your girlfriend, your wife, not your daughter, please.
They might not know how to do it.
Yes. Okay, let them do it for you.
Great. We'll take our last commercial break and we'll be back to round up.
Heroes Cable Network.
Welcome back. Yes, you've been here with us. This is Heroes Cable Network, HCN. Be sure to like us on Facebook, on Instagram, and on YouTube, and hit that notification button. So whenever we are online with such educative programs, you'll be the first, the first among the lot to watch. Okay. This is Heroes Cable Network. As I said, we are all about promoting our culture, our tradition, our education, and development in our community. There's a whole lot of stuff that concerns us as a community, okay? And so we have to promote ourselves. Nobody will do it for us. That is why we are here. HCN is doing it. So we need all your support. Go out there and support us. October is Breast Cancer Awareness Month. So you see us all in our pinky. Yeah, we tried as much as possible to be pinky today. So that is why we are in pink, and we are trying to create the awareness. There are a lot of people out there. October, people are organizing, they're having fundraising events, rallies, concerts, all that they're doing just to support our community, to support people around us who are going through these trial times in their lives. And so let's all support. If you know somebody who is going through breast cancer, or you see anything on somebody that you think they should go for any examination or anything, please, please, please do not hesitate. Tell that person. Tell your brother, your sister. No, now we know men get it too. So it's not about women. Whenever we hear breast cancer, it's like, oh, it's women. No, men get it too. So let's do the check. We just watched the video on the self-examination. So if you can go back to watch that video anytime on YouTube, on Facebook, anywhere, HCN, and just do the breast self-check, please. Let's do it. If you're a woman, 3 days to a week after your menstrual cycle, after your menstruation. And if you're a man, as Ms. Abba said, you can just choose any day of the month, depending on, or you can use your birthday, the day that you were born, whether the 1st, 2nd, or 3rd of every month, and do that check. It's just to remind you, So I'm going to keep that in mind and be doing that. Sometimes you miss it. Right. Sometimes by the time I realize, so yeah. And so we all have to try as much as possible to do that self-check and that yearly mammogram if you're of that age. Please, please, please. And can we also do it for teenagers?
No.
Coming up, can we do that check on them?
Not at that age, But even though they are menstruating, it's well, when you think about it, because it's very rare for them to have breast cancer unless there's a genetic mutation going on. Yes,
but then you never know, right?
So it's better.
I think it's better to start them early to get used to it.
Absolutely.
Yeah.
So for teenagers and stuff, they're still pediatric level.
Okay.
So
by law, or if you doing what it's you're supposed to be doing, you should be taking them to the doctor every year physical.
Exactly.
Yes.
So at least they do not really have to do it every month, because there's no one of the risk factors is mothers that have babies after the age of, I think, 29 or 30.
Yes.
So that puts you into a high risk.
Okay.
So a 16-year-old doing self-breast exam is really not, unless they feel something too or something. Not that it cannot happen, it can, but I have not all read or seen any
at that age.
Especially teen that is getting that. I've seen like as early as 21 and some, but that teen age usually it will be caught at the PCP or the doctor's office because they go for yearly checkup.
Wow.
I mean, trust me, I'm a mother of 3 girls, and has that crossed my mind so many times to teach them, but I forget.
I know. It's not easy.
Yes.
Yeah, it's not easy. Yes. It's not easy. Yeah. So we are grateful to our guests right here in the studios, Abba and Profi Ham and Margaret Corte Papafield. They are both nurses who work right here with medical institutions in the DFW MedPress, and they've been helping us, dive into all the preventive measures, the causes, and what to do, every month, for early detection, okay? For early detection, very key. Early detection is very key. And we are grateful to you viewers for spending your time listening to us and watching us from wherever you are, the comfort of your home or at work or wherever you are. Thank you for tuning in. And this is the Women's Digest. Until we come your way another time, my name is Miss Dell, and you have been watching HCN Heroes Cable Network. Stay safe out there. Bye-bye.
Heroes Cable Network.